Hello, everyone. My name is Rachel. I'm a graduate with a doctorate in pharmacy, and I've had 2 years of experience with pharmacogenetics-based biotech company called Genelex, and we use software to individualize patient medicine. My goal here is to not necessarily, I have a difficult topic, but the goal is to just increase the discussion about using software to do this. So the overview is to paint the picture as to why pharmacogenetics is important. I'm going to give you a crash course on pharmacogenetics, and throughout this, I want you to ask yourself, is pharmacogenetics the future of medicine? Adverse drug reactions are an avoidable medical problem. They're the 4th leading cause of death in the US, and get this, 100,000 deaths per year are by properly prescribed medications. Treatment failures increase the cost of healthcare, and they're very common and prevalent in disease states, such as depression, arthritis, and diabetes. And a large contributor to this is driven by genetic differences in metabolism, or drug-gene interactions. 50% of all medications are processed by genetic-specific enzymes called cytochromes, or CYPs, and more than 75% of the population have genetic variations that increase their risk for adverse drug events. Did you know that 118 drugs actually have genetic-specific information in their product inserts? If you look through all of these, you'll see some common medications, your antidepressants, your immunosuppressants. In addition, as comorbidities increase, the number of medications prescribed increase. As the amount of medications prescribed increase, the amount of drug-drug interactions increase as well. What is pharmacogenetics? It's the understanding of how genetic variability alters drug response. You may have heard of this as personalized prescribing or individualized medicine. The goal is to increase efficacy and decrease side effects, basically personalizing medications to the patient. Cytochromes are the drug-metabolizing enzymes in the liver and intestine, and I want you to think of these as the metabolic factories that break down drugs in the body. You have phenotypes, poor, intermediate, normal, and ultra-rapid metabolizers. To sort of demonstrate this, I want you to think of the body as a sink with a constant influx of water, which stands for the medication. You have your poor metabolizers, which have a very, very small drain. So the water flows in, but it doesn't drain fast enough, and as a result, the water overflows. You get side effects. On the other side, you have your ultra-rapid metabolizers, who have a very big sink drain. And as the water goes through, it drains so quickly that there's no water left in the sink, no drug in the body, no efficacy of the drug. This is a very difficult and convoluted slide, but what I want you to see is the normal column. There is no column that has 100%. We're all very different, and this is why you are going to metabolize drugs differently than somebody over here is. To add yet another layer, medications and supplements may block these enzyme functions, or they may increase the expression of cytochromes in the body, which also, in addition, leads to adverse effects or decreased efficacy. The answer is personalized prescribing. Instead of a cookie-cutter dose, we're able to individualize medicines to the patient, whether it's the dose, the type of drug, it all varies, and you use this via the basic use for it is software. Like I said, I've had the opportunity to work on a software program like this. On one end, I've done the literature review to help with the algorithm that helps predict drug levels in the body. And on the other side, I've used this algorithm to help predict for clinically relevant drug-drug and drug-gene responses. There are challenges to this. Genetic testing is expensive at this point. Insurance coverage is limited. And since a lot of us are scientists here, there's no randomized controlled trials or cost-benefit analyses to show of yet. However, there is current research coming up. There's an impact registry study that shows, the goal is to show the benefit of software in real-life practice, and then there's also a randomized controlled trial, the VRX trial, coming up, and you can see those on clinicaltrials.gov. For those who are more interested in pharmacogenetic information, PharmGKB is an objective resource through Stanford, and it also has pharmacogenomic-based drug dosing guidelines, and there's PharmGened tutorials that provide a little bit more information about it. So in conclusion, there are a lot of drug-drug and drug-gene interactions that I threw at you, and these basically interfere, but we can use software to predict them. The only problem, once again, is that we always need more research, since this is a very new field. However, if a drug doesn't work, or if it's causing side effects that you might not necessarily expect, I want you to think about not ruling out genetics just yet. I asked you a trick question. because pharmacogenetics is the future, but the future is now, and the future is here. Thank you.